Good day to you all. Hope you all doing fine and that all is well wherever you are. So today I decided to do this while at work because it entails whatever I'm doing. So someone asked me about the nursing profession and how it is, how I find it. So this is my journey. So my journey started long time ago when I was still young and I didn't know what actually to pursue in life. So I can say my dream when I was young, I think, was to become a judge. I really wanted to become a judge or a lawyer, and that is what my focus was. So until I don't know what changed my mind, but even after my Form 4, I remember telling Prof that I want to be a judge, I want to be a lawyer. And then he actually asked me, so who will give you this job? Because being a lawyer, being a judge, it involves a lot. So just to take us back, so when I was still young, I think in class 6, 7, I have a brother. Our firstborn is always asthmatic. I'm also asthmatic, but his is extreme. Like he get those attacks like every other day. And so when he was young, I used to see him struggle so much, trying to breathe, and sometimes he used to take those drugs, and then he could even inject himself some medications that I didn't know what they were by that time. So I told myself that when I grow up, I want to know what this is. I want to know what asthma is. I want to know why they have these symptoms that I are having. So that was when I was still young. But now I wanted to be a doctor and I wanted to be a judge. So judge part was on the higher side. So until when I finished my I can say class 8, I went to high school and I finished. I passed well. My IQ, by the way, is up there. I'm a very bright person. I can, I don't know. I just didn't do actuarial science and all those tough ones, but I think I could have given the opportunity. So what happened is after my Form 4, my first attempt, I tried to apply for MTC. There was that MTC, and those days they tell you, okay, apply, write the first 3 courses that you want to do and all that. So the first 3 courses that I wrote was clinical medicine, pharmacy, and nursing. I think nursing was the last one. I didn't know much about it. I just I don't know. People used to tell us nursing, you just wipe patients and all that. So I didn't get it the first trial. Then the second trial, we have a very great family friend by the name Professor Uta. So he's a family friend. He's been there for us, and I can't tell it all. May the Lord just bless them wherever they are. That family has stood with us in our academics, in our social life. They've been so great to us, and we just want to wish them the very best, that one day we will reciprocate whatever they did to us to the generation that will be behind us. So through him I got my letter to join MTC. And so I got a letter to go to Msambweni MTC. And Msambweni MTC is actually several kilometers away. Remember, this is a naive girl. This is a small girl. This is a village girl who I can't remember the farthest place to gone. I think I went to Nakuru for a few days and then went back home. So the farthest I had gone, I can say, is just Nakuru. So this is someone who's gotten a letter to join MTC. And that is Siaya County to Kwale County. So you can imagine. So being a daddy's girl, dad was like, no, you're not going, that is fine, all that. So Prof had to tell dad, like, just allow her go start, because getting these chances are hard. Then we'll work it out and maybe we can get a transfer or something. But I knew that was just that. But I also thank God, because going far from family and from people actually made me work extra hard, because I saw that how would I come this far and then disappoint my parents and disappoint the people who stood with me so very much. So I came to MTC in 2011. That was September, and the course takes 3.5 years, but by the time you finish, it's even 4.5. So I graduated in 2015. So I didn't stay home that much. I didn't hustle because meaning to favor. When you ask God for favor, the favor will always be there for you. So I got a job. I can say my first job was at Pandya Hospital, Pandya Memorial Hospital, that is Mombasa. Through the influence of Mrs. Prof, I was able to get a job there. And so it was just favor. You just told, okay, you go and talk to the administrator and tell them that I've sent you. So that is what he did. So I went, talked to the administrator, told him, okay, I've been sent by so-and-so. And then you were like, where are your papers and all that? So I got a job at Pandya Memorial Hospital. So I worked there for 2 years, 2016, 2017, and part of 2018, before moving to the county, to Mombasa County, where I worked as a contract nurse for like a year before being put on permanent and pensionable. So I can say I've been working for like 5 years, and when I was working at Pandya Memorial Hospital, something just came in me, like, why can't I do my bachelor's? Why can't I do this and that? So in 2018 September, I decided to enroll myself for a bachelor's program, because I remember Prof one day told me that what Dad did was just a stepping stone. So it's me to make my dreams come true. It's me to make my nursing journey more successful. So I told myself the best thing I will do is just to take myself to go back to school. So I enrolled for the distance learning program, and it was a success because I graduated last year. That is November 2021. I graduated last year with bachelor's in nursing. So from there, I can say that was more about my academical part. So what I can say is nursing is a good cause. It's a profession that anybody will love to do, and it's fulfilling. But what is important is we need to understand that, are we doing it? What are we doing it for? Are you doing it because it's a passion? Are you doing it because you care? Are you doing it because of the money? No. You need to understand that I'm doing this because of this and that and that. Because if you're doing it because of money, hey, you leave the first day you get into the hospital, because that money is never there. It's never there. It's never there. Out there, you think people are being paid so a lot. No. If it's because of money, just change your mind. But if you're doing it because you love what you're doing, you love seeing this patients get better, you love doing it from your heart, like, okay, I want this patient to feel good, and all that. I always feel satisfied when a patient tells me, oh, you did this, and I'm feeling much, much better. And so some of my personalities that have made me going is that I'm very social. So even with the patients, I'll come, say hello, talk and joke with you and all that, because that is just me. So another thing is, you need to be up to date with whatever thing that is happening. Don't just sit there and do nothing. Sit there and do something. If it's something that you can't do, don't sit and wait for the doctor. No. You have to do something just to change the state of that patient that you're handling. You have to do something to change the state of that child you're handling, because these small things is what matters in nursing. How we talk to our patients matters. By the way, communication skills is very, very key. And how we talk to patients is one thing that can either make them trust us with what you're doing or make them hate us with what you're doing. So that is one great thing. Sometimes you find we talk to them so rudely. We talk to them in a way that doesn't add up. And at the end of the day, it is just us and them. So with patients, let us take care of them. Let us do what we have to do to ensure that their lives always change for the good. And the procedures that we do, ensure that you do it with utmost dignity, utmost you use all the ethical standards that you're supposed to do, because that is the most important thing. Otherwise, that's it, and you need to keep doing what you're doing, keep loving doing what you're doing. It doesn't matter the profession that you have, it doesn't matter what you're doing at the moment, but if you're doing it with love, my friend, it will just flourish. You'll just find every morning you wake up, you don't feel a burden. You just wake up and then you say, I'm going to work, because it's fulfilling. And the most important thing that I would love to tell us, invoke God. Talk to God. Tell God, God, I'm in this profession, but I just need you. That is my routine. Every day that I wake up, every day that I do my fasting, every day that I need God to do something for me, I always tell God that, God, this profession is not an easy one, but I know you're going to take me through. Because we see a lot, sometimes you're asked out there, we have hearts that are so hard. We've seen a lot, and we are seeing a lot, and you can imagine seeing all this for the next 30, 40 years. It's a lot. So you just need to tell God to give you the strength, the grace to endure everything that we do at all times, because it's one great thing, so let's do it with love. That is one thing. Let's involve God. Let's tell God, God, I know you're going to make things beautiful. Make this a beautiful day. Every time you get into a shift, just do something. I have friends and colleagues who even tell you, Lillian, I think this is not normal. We just pray for this patient. Wherever you are praying, just pray for this person. And by the way, some things you involve God. Even when you're giving those drugs, involve God. Tell God, okay, I'm giving these drugs, but I know healing comments from you. So I want you to heal this person. Bless the works of my hands. So everything that you lay your hand on will actually work out for good, because God has blessed the works of your hand. If it is stitching and doing any other procedure and all that, God will have blessed the works of your hand. And so it will never go in vain, because God loves you. And so when we are doing this, let's do it with love. Let's do everything that we are doing with love. Let's take care of our patients and our clients. Let's handle them with utmost dignity, with utmost respect. This, I always tell myself that they are my bosses, because I'm working here because of the patients. If they're not there, I'll not be working here. So let us respect them. Let us do the will of God, and let us involve God in everything that we do. Otherwise, I just want to wish us the very, very best. In any profession that you are in, just do it with love, just work it out and tell God that, God, I know it's all about you, so that at the end of the day, you find the fulfillment in you. There are so many challenges that we encounter, but now it depends with your attitude. But that's the most important thing. You need to work on our attitude at workplace, at home, and all that, so that everything that we do becomes a success. Otherwise, for the last 5 years in this field, I can say it's one of the best. It's one of the best. And any other person who is out there who thinks that, oh, no, it's not working out. I've even been with people who've been in this profession for a while, those who've even retired, and they're saying it's the best if you have the good mindset, you have the good attitude, you involve God, you do it with love. It's always all about doing it with love at all times, because that's it. You can do nothing, when God is in control, it will always work out. Otherwise, we wish you the very best.